this Omicron wave is like nothing we've seen before in the sense that it is accelerating at a rate we've never seen before. It is the most transmissible of all of the COVID variants by quite a lot, almost as transmissible as measles, maybe as transmissible, which is the most transmissible virus agent we know. And so that's why you're seeing the steep rise, especially in New York and Washington. And now the hospitalizations are picking up in New York and Washington. There's a buzz out there that's saying Omicron may not be as serious as the previous lineages like Delta, et cetera. I don't think that's the case. I think it's probably going to be as serious among the unvaccinated for reasons that we can go into. But we are starting to see hospitalizations in New York and Washington, and it's going to be across the country. That's point one. Almost all of those hospitalizations are going to be among people who've not been vaccinated. The number that's about out there is about 85, 87% of the severe illness and deaths are among the unvaccinated. The others mostly among the partially vaccinated. So we'll see that same pattern again. But here's the second hit we're going to face right now. Because this is so transmissible, and we are seeing that the booster shot is not quite as effective as the other boosters, as was pointed out. It's as effective at preventing death or serious illness, but it's not as effective at preventing symptomatic infection. So the problem that we face, this very unique wave, is that in addition to unvaccinated piling into the hospitals and ICUs, the healthcare workers, a lot of them are going to get breakthrough symptomatic infection even after their booster, which is not going to land them in the hospital, but it's going to keep them at home and out of the workforce. So you're going to see, we've already had a depletion of our healthcare workforce over the last 2 years for a lot of reasons, for attrition and burnout and all of the other factors that we've been hearing about. But on top of that, we're going to knock out an additional big segment of the workforce. And we know that mortality, death rates really climb when hospitals are going to get overwhelmed. And so that's what I'm worried about. It's going to be the unvaccinated piling into hospitals, and there's not going to be enough doctors, nurses, respiratory therapists to take care of them. And you're going to see mortality really start to climb. Two other things, and then I'll stop, which is
sure.
The other thing we're finding is with this highly mutated virus, 2 of the 3 monoclonal antibodies that we have are not working. So we're not going to have as many treatment options. That Paxlovid medicine from Pfizer, forget it. It's not going to be ready in time for this wave. It's going to take months before we have enough of it. So we've got a lot of vulnerabilities, and our only real hope is that we persuade the unvaccinated to start getting vaccinated now, get that vaccination series. Otherwise, we're going to repeat what we've already just experienced. And what we've just experienced, Roland, and you alluded to it, is that since June 1 of this year, over the last 6 months, 200,000 unvaccinated Americans have needlessly lost their lives because they refused COVID vaccines, including the first death that we've had from Omicron last night in Houston, an individual who was infected and recovered, but decided not to get vaccinated on top of it because Omicron can cause reinfections very easily. So that 200,000 number of people who threw their lives away because they refused to get vaccinated over the last 6 months, that number is scheduled to double now, between now and the first quarter of 2022, to 400,000 Americans whose lives could have been saved, but they chose not to get vaccinated. And so that's why I'm here late on a Thursday evening before Christmas to work with you, Roland, to do whatever we can to get people to get vaccinated.